Are you in every way, woman?
We're back with Every Way Woman, and when life seems to stop with cancer, after treatment, it must go on. Sherry Kinnison is a survivor, and I want to talk about what happens when treatment's over. How did you feel?
Well, I'm being with BreastLink once again. I was very fortunate because that does happen to the majority of the women across the country. But Dr. Link, Dr. West, Dr. Kapoor, they have a program implemented that when they're through, we've gotten to know a lot of the patients, and those patients know that we're not going away. We're still here for you. And I think that...
I mean, because you're only going to see the doctor once a year, maybe?
But there's still a support group. There's probably 10 or 12 of us at BreastLink that, depending on your age and depending on what you went through, we try to pair you up with someone that went through the same thing. And honestly, you become good friends.
Did you feel alone?
I was lucky. I didn't feel alone. I have a husband. I have a daughter. I had the whole team at BreastLink. And I had the survivor, they held my hand, Jenny Pepin, she's the warrior of all of us women that she's been there the longest
Sherry,
and teaching us.
You have a great story, but what about that woman who doesn't have the BreastLink experience? What do I say to her?
It's hard. She has to find people that can.
There's no information. There's lack of information. I went through my chemo, and just like you were diagnosed, the doctor said, okay, now you're done.
Right.
They dropped me. What do I do?
You have to research. You have to become so proactive. Women have to become so proactive in their own right if you don't have, the specialty doctors and you don't know where to go.
But as specialty doctors, what do you tell your patients when they leave the doors, when treatment's over?
We have a very solid relationship. We've been through a lot together in a year. We really can look them in the eye. And some patients, you have to kind of taper them down a little bit because they do, feel uncomfortable. But you're like, it's like when your teenager leaves the house, or we graduate to different phases. We want to help them make the transition and feel self-contained, not feel dependent. Certainly we're there for them at any point in time, but we feel like in most cases, they've built up their own personal strength that they're prepared to handle it. And when they need to come back sooner, we bring them back sooner.
We still always try to be there for them all the time. I mean, I have patients
How
calling
accessible are you?
We make ourselves very accessible. I mean, we have a policy to answer phone calls within a day and see patients within 2 days or sooner.
So then, as I was talking to Sherry, so as part of the process, if I'm not able to work with BreastLink, I should definitely look out. I should find a doctor who, at bare minimum, will at least call me after the treatment and say, hey, how you doing? At bare minimum, right? Is that what I should ask that question?
You want a physician who's accessible. You want to feel comfortable in your care. It's your life and your body. You have to be the one leading it, dictating it, knowing that, well, this is my doctor. I don't really like him, but I think, no. Nope. Look for the doctor that makes you feel comfortable.
Well,
don't stop with that.
In that, there was a special moment for you, Sherry, and Dr. West when you realized that he was the doctor for you.
Yes.
Right.
Tell me about that moment.
He called me that next morning and said, I want you to come this evening, and I want to see you after all my patients are through. And I said, I just can't do this. I went through this yesterday with a doctor, and I don't want to deal with it. He said, just come and see me. I'm not that other doctor. And that did it.
Wow.
So I went to him, and at 7 o'clock at night.
But he had to come after you, though.
He had to come after me. He had to make that phone call, and he made me realize that he is different. He is the passionate doctor
Did he
for
make
breast
you
cancer.
realize that you could be a survivor at that point?
Yes, he said, we'll get through this. You just come and see me. And we did. My daughter, my husband, and we went down that evening, and him and his nurse were there, and they did a biopsy right there in the office.
And how do you let other women know that they could be survivors? There's one thing from the doctor, but what do you specifically do?
I really talk to them one-on-one. I tell them about my fear I had, and I'm telling you, I don't think anybody had the fear I had. And
Are you still afraid, though?
Yes.
No.
Why is that?
Because, now I'm a 10-year survivor this month.
Woo!
And so, I can do the happy dance. But, you know, I tell them we take baby steps. You know, we go through that first year and then that second year. And each year it just gets.
So in the back of your mind, you don't ever think, wow, I mean, I've made it, but I don't know if I'm going to get to year 11.
You know what? I don't let myself go there. I make myself just enjoy life for the day because we're all going to go at some point in life. And now, you know, I just realized I can make a difference. And, you know, you want to do that. Once you become a survivor and once you know you can thrive, you truly, I know I can sit with a woman and change her life when she's diagnosed.
And part of that is our job. I mean,
Yes.
we really want to make sure that our women stay survivors. We make sure that they get screened. We make sure they stay healthy. We make sure they have a support group and that they're regularly seeing us still. We need to stay with them as a team. We take them through. We don't just drop them and say, goodbye, you're done. No, we keep them close
So
by.
education and having a support system, all of those things are pertinent. Because again, I appreciate that. I'm just asking for, you know, the woman. So you've answered my question.
And positive doctors.
Positive doctors.
You know, a lot of doctors need to take a Dale Carnegie course. But it makes the
Wow,
difference.
that's great.
Well, we really appreciate your positivity, doctors, and you sharing your story with us, Sherry, and holding the hands.
Holding
Thank
hands.
you.
Keep
Yes.
holding
So
it.
wonderful. Stay strong, keep surviving. We'll be back with more Every Way Woman after this.
Are you in every way woman?